Welcome back. It's 10 minutes after 8 o'clock. If you're watching The Time this Friday, great to have you here on ENCA. The Special Investigating Unit, the SIU, very concerned over what is a surge in fraudulent medico-legal claims. They've actually increased by 10% in the last 5 years. Here's the really staggering part of the story. It's costing the health department 77 billion rand. So the SIU has been able to block some of them, saving the department millions. But why are they doing that? The unit's spokesperson, Kaizer Kganyago, joining us now. Why are we seeing such a spike in your investigations? Why have we been seeing such a spike, Kaizer? Good morning to you. In medico-legal claims. Is the health department getting a lot of things wrong?
Good morning, Gareth, and good morning to your viewers. Not necessarily. We have got a syndicate that has been working around in the field where they are creating bogus kind of claims, where when they go around searching for children who might have been sick, and they then attach that to specific hospitals and say it is because of the way the child was treated in that hospital that we find ourselves in this situation. Therefore, most of those claims are bogus claims, and they are orchestrated. We saw that when we were working in the Eastern Cape, where we started with the investigation. And we found that in one of the towns there, the whole town is full of lawyers, and their main task is to deal with medico-legal matters. And they have just done exactly that, because when we did our investigation, Karen, we found, for example, in instances where a child is said to have been born at a specific hospital, and because of negligence, the child is not well, has got cerebral palsy. But when we went to check with the family, the child was born at home.
So what now? What do you now start to do with this? How do you get to the bottom? Because you're not medical malpractice auditors. How do you, as the SIU, try and get on top of this?
Yeah, what we did was to go and do a proclamation, which was granted by the president. We are now in a position to investigate all of these claims in all the provinces. And in cases where those people have not done what they are supposed to do, we then take them to the NPA to be charged, but we also recover the money that they might have gotten illegally from these departments of health in the whole country.
So when we talk about some of those matters that you're dealing with, I'm seeing reports, Kaizer, of 158 matters that you've been dealing with. Now, just give me a sense of the amount of money that has been recovered.
At the moment, we do not have a specific amount that we can put up. But we are saying, because, people will always resist and try and go to court. This is a fairly new investigation that we have done, but we have blocked even those that have not been paid as yet, because we were very mindful of the fact that in some of the instances, the payment was still due, because these syndicates are working with people within the hospitals themselves. They make sure that the files and the contents of the files disappear out of the hospital, so that the hospitals are not able to defend themselves when the claims come into the courts.
Just so we're not misunderstanding, or at least I'm not misunderstanding how this works. So you've got the syndicate, then you've got those working within the hospital, which we'll talk about in a moment. But the supposed claimants, you use the example of a child born with supposedly cerebral palsy in the hospital. That wasn't the case. The baby was born at home. Are people fake patients? Are they getting money? How far down does this corruption go? Are they part of the syndicates? Because obviously their names are being used.
In some of the instances, and it's a majority of it, they don't even get that money. The money ends up with these lawyers that are making the claims. Therefore, in some instances, they give them. That is why now, those that are not getting the money were able to report these matters to us, because they are being used as pawns for these claims, and at the end, they get given meager amounts or nothing at all. And that is where the issue is with these syndicates. And it's basically lawyers.
It's basically lawyers. I like the way you ended that sentence. What happens now, though? Are we dealing with the health department? Are we talking specifically investigations within certain hospitals? How wide does this net of yours need to go? Because obviously you've uncovered the hornet's nest, but you can also only go so far. What is the health department? Where do they come into this?
Yes, our proclamation covers all the provincial government, health departments and the National Department of Health, which basically means we can investigate each and every case in each and every hospital in this country. That is how far we go. That is why we needed to get more people to help us with this. But also, in this particular instance, we also are employing what we call tracers, who will trace these families around to make sure that we get all the information that we need.
Well, while you're employing those tracers and they're doing their work, what do members of the public need to do? How can they assist? Perhaps there's someone watching who knows about someone that's been involved in this. Perhaps they're a victim in this sort of syndicate. Are you calling on the public for any assistance, Kaizer? If so, what do they need to give you? What info do you need?
Yes, we always say that we cannot do this work without the members of the public. And we are saying to the members of the public, please, if you've got that kind of information, you can get to our nearest offices and make sure that you give us the information that we need. Or you can be in a position where you can then be in to phone us as the organization and get our numbers from social media and everywhere else to make sure that people are aware. Because the money that is being used there, that they claim, deprives them of medication, it deprives them of other facilities that they might have in that hospital, because most of the money that was not budgeted for go to these people who make the claim.
And I'm so glad you phrased it like that, Kaizer, as well. As a last question to you, because what this has, when we're talking numbers, 77 billion rand in the past 5 years. When you take a look at our public hospitals, Helen Joseph, Rahima Musa, that's just here in the Joburg, Gauteng area. That's a lot of money that could have gone on to improve hospitals and improve healthcare for patients as well. That's the everyday effect on patients in this, isn't it?
Definitely, and that is why it is important for the public to work with us. If you want good services in our hospital, let us stop these crooks and syndicates from doing what they are doing, and that money will be used for what it is intended for.
Oh, there we go. That's straight from the SIU's Kaizer Kganyago telling the public, if you're aware of this, and it's difficult to imagine that those who have been involved in hospitals, they've needed care and something hasn't gone right, and you've had what seems to be a scrupulous lawyer coming across saying, well, I can help you with this claim. Be very, very careful as well, because it might not be what you think. But now you know what to do, so just keep an eye out.
And I wonder what role the Legal Practice Council is playing in this, because they're the ones that should really be overseeing the legal fraternity. Are they involved in these investigations? Do they know about this? But if you can't trust lawyers, who can you trust?
Well, that's why I had a good giggle when Kaizer mentioned lawyers the way he did, because it's a bad reputation and this is not going to help. It's a great idea, actually. I think maybe we will get hold of the legal counsel on this, take that story a little bit forward.